Please, the northern parts of Ghana have decided to come together. So if you are from Upper East, Upper West, and then the northern region, you are all coming. Northeast, you are all coming together. Savannah. All the northerners. I want to see you, my father. Bono is over. Okay. This is for the northern part of Ghana. Okay. Northern part of Ghana. Okay. Hello. Okay. So we'll sing. Which one? Dimo yeah yeah yeah. Dimo yeah yeah yeah. Madala Yerusalma. Kanchana kansen damda kada gorna nyama kumda ale nyama kumda nyenda salmade ayeda nyama de apa nyama de jaskalanga dimo ye ya ye madala Yerusalma kanchana kansen damda kada gorna nyama kumda ale nyama kumda nyenda salmade ayeda nyama de apa nyama de jaskalanga. Wow. Thank you very much. Thank you very much. Imaramba. You are welcome, Imaramba. Western and Western North. Western and Western North. Rep your region. Western and Western North. Show yourself. Make hay while the sun shines. Western and Western North, please. Please, let's save time, please. Other regions, please be planning. You can tell the DJ the song you want when your region is mentioned. The other regions. Western and Western North. The best comes from the west. Yawazoye from the western region. Okay, please, we are waiting for you. As they prepare to come, we are urging the other regions to be prepared so that once we mention your region, you know what you are doing, please. Mr. DJ, we want Jeduambule as entrance for the Western region, Western and Western North. Rajo. Yes, that's from Western region. Ambling for the Westerners. Rajo. Mr. DJ. Western, please. Oh, they can come.
She's a zero. Then, because why you not brush your teeth? It's really very cheap, so why you not brush your teeth at night?
He's right, and he's helping.
So I go talk to Baba was God. And that I go sell on the so never was a one. I want to carry out the shadow.
Central region. Anyhow, you represent it. So you can represent both. Ọ̀pá-ìtìntìn àwárí èmi ń kó. Sẹ́mi. Sẹ́mi nyámẹ́kọ̀ náà sẹ́mi. Ọ̀pá-ìtìntìn àwárí èmi ń kó náà sẹ́mi símẹ́chà. Ọ̀pá-ìtìntìn àwárí èmi ń kó. Oh, quite in our DJ.
Hello guys. Do you know that the Abena
region. Thank you so much. Thank you so much. Hello, Didi Ernestina, our microphone. All right, Eastern region. Eastern region. Show us what you got. Show us what your mama gave you. Eastern region. Koforidia flowers. Koforidia flowers. Okay. We are waiting for you. Our time is fast spent. Let's double up, please. So interesting. Depot time. Says memories. Yes. Bono East and Ahafo. Understand?
banjo.
Ashanti, sorry, Greater Accra region. Obake, Greater Accra region.
Hey, banjo.
from the British Accra to the Osu, through the Labadi, Lamami, Teshimami.
Tema.
Obake. Thank you very much.
Thank you very much. Bono East and Ahafo. Bono East and Ahafo. If you are not ready, are you ready?
Bono and Ahafo. That's right. Yeah.
And Ahafo has something nice to tell us. So let's listen to them, please.
We are going to talk more about Bono East region. Bono East region, where we have the center of Ghana located, and everyone is invited to come and see where the point center of Ghana is located in Bono East, which has a land size of about 22,000 meters square, with a population of over 200,000 population. We are the center of food for Ghana. We produce a whole lot of food and we feed majority of Ghanaians. In fact, Bono East is the most welcoming area where every bus stop to see and eat. You are all welcome to Bono East. Thank you.
Thank you very much.
Thank you very much. Bono East and Ahafo region.
once again, and we pride ourselves from all the regions that we represent. Thank you very much for the beautiful display of our culture.
We will continue with a panel discussion on administration and management of nursing and midwifery. Because of time, the Director Nursing and Midwifery cannot do the presentation on administration and management. And so we are moving straight to the panel discussion. And so we call on our moderator for this session, who is ACP Dr. Kennedy Giapon, Director Nursing and Midwifery, Ghana Police Health Services.
While we await our moderator, I can say we represented Ghana, so it will be a very beautiful display if we could be on our feet and sing the national anthem. As we await our moderator, please, for Ghana, this one is for Ghana. God bless our homeland and make our nation great and strong, bold to defend forever the cost of freedom and of right. Fill our hearts with true humility. Make us cherish fearless honesty and help us to resist oppressors' rule with all our will and might forevermore, and help us to resist oppressors' rule with all our will and might forevermore. I think Ghana deserves a shout. Please have your seats humbly.
Okay. Kennedy Giampion, Director, Nursing and Midwifery, Ghana Police Health Services. Can we
With a round of applause, let's welcome our moderator. Thank you very much. So you introduce the panelists.
Very well. Good morning to us all. Choboy! Choboy! I am seizing this opportunity to say Choboy, because we don't say Choboy. The moment we say Choboy, you'll be invited. But at this forum, I have the opportunity to say Choboy because I belong. Unity. Unity. Are you sure? I can't hear you. Unity. Okay, so for sake of time, I will not want to go into the details. There will be mundane. So I just want to stand on the existed protocols and to say we are all here together. Thank you very much. I have been tasked, and my task is so simple, to lead today's panel, and for that matter, moderate. How many of you are aware that the Ghana Police Service have nurses and midwives? And are you aware that they are all over the regions? Great. I'm inviting some of you to join the family. Tell the younger ones who are within the age brackets, if you are above 35, we'll cut you. All right, the task I'm leading today it has to do with something we have discussed over and again, and even yesterday, a few of them were touched. However, we need to highlight on the salient ones. The vexed aspect has to do with nursing and midwifery administration and management in Ghana. We are looking at the building strong leadership for better health outcomes, and using this foundational building blocks had to do with management, practice, clinical education, research, monitoring, and evaluation. But as I said, some of these were tackled in the previous discussions. To do with me this morning on the topic, I have my vexed and well-experienced nurse managers, to include the regional CNMO, retired Madam Stella Sefa. Is she here? Shall we welcome her onto the podium? Let me introduce something. Probably it is worth adapting. I just put the mic down and demonstrate it. Anytime anybody is being introduced and welcome to the podium, we do this. So you do that until the person assumes their seat. So we will try it as we move along. Next is DDNS Esnam Adinati, the nurse manager for Lekman Hospital. Is she here? This one is not our way out. Thank you, thank you. We have the DDNS. Okay, DDNS Efua Williams, the nurse manager, Ganoff Hospital. Are you here? If I were alone, the next person I wouldn't have introduced, but for the sake of the program, Mrs. Judith Siama, Director, Nursing and Midwifery Services, UGMs. Why don't you wait? Thank you, thank you. Then we have Madam Joyce Amamu Eshon, the Regional Chief Nursing and Midwifery Officer, Bunu East. Isn't that beautiful? I've always said that without nursing and midwifery in our health profession, then Ghana wouldn't have a place. And I'm not wrong. Thank you very much for giving me your indulgence. Panelists, you're welcome. We have a simple but complex task. And mentioned early on, we are going to look at the general to the specifics. Our goal is to explore strategies, systems, and leadership approaches for strengthening nursing and midwifery administration, management, to enhance service quality and workforce performance across all levels of care. I have this philosophical belief, should I say belief? No. Fixation or obsession that leadership is a responsibility. And leadership is at all levels. Many a time we somewhat think that when you are at the top is when you exude leadership. But leadership is at all levels. For this, nursing and midwifery administration and management form the backbone. Sometimes I find it so mundane repeating this because it's a vague statement that is non-negotiable and cannot be argued. It's just because we don't assert often. But we all know if we decide that we are going to sit just for a minute, the whole nation will be rocked. We are not doing it. I urge you, one day we have to do that. I know director will not agree with me because they will come at you. So, from policy to bedside, effective leadership determines the quality, coordination, sustainability of nursing and midwifery services. And so, we ask, how can we improve nursing and midwifery administration, management to strengthen performance, accountability, and better outcomes in Ghana as far as the health sector is concerned? And so, with my able panelists, we would attempt to go through. I know these are well-vexed nurse managers, astute and well-groomed. And so they will take us through. With your help, we get to unravel some of the best practices so as to leverage ourselves in Ghana. Having said so, I will begin from my right. I will equally be part of it. I am fully part of it. I'll be given most of the answers. So, never mind. Should I be here or here? Don't worry. I prefer standing. Those of you who are, and they are giving me time. Don't mind. Sometimes Director One, will you support me? So, How would you assess the current state of nursing and midwifery administration and management in Ghana if you were put to this? Madam?
Thank you very much. Looking at nursing and midwifery administration and management, I will start with to say that there is some positive direction. Why am I saying that? Previously, we were not having strategic plan. Now, the Ministry of Health is having a strategic plan for nursing and midwifery. When you come down, you realize that Nursing and Midwifery Council is also having a lot of CPDs on leadership and management, which is helping nurses and midwives. Then, when we come to Ghana Health Service, we have also done assessments of how nursing and midwifery leadership and management is from the office of our Director Nursing and Midwifery early this year. And from all that we saw, it's like we are heading towards a positive direction. We have plans to improve. However, there are a lot of challenges, a lot of gaps, looking at even the assessment that we did. There are times you enter a facility. I think it was done across all the 16 regions. Some facilities, even nursing administration, they don't even have. When it comes to organogram, there is nothing like organogram at the nurse manager's office. When it comes to logistics, it's also another challenge. So you look at it and then it's a lot. When it comes to even nursing administration, having meetings, it's also another thing. Some even don't even meet. Those who are meeting, it's not regular. And then if you look at all these at the urban areas, even it is a bit better. When you go down to the health centers, it's also a bit of a challenge. Who are the leaders there? We don't have them. Today, you put somebody there. If I use my region as an example, you go there and the senior most is the senior nursing, senior staff nurse who is managing. You train the person or you mentor the person, the next minute the person is in school. So you realize that there is a very big gap at that end. Thank you.
Thank you very much. Very appreciable. You've been able to talk about the challenges therein, and then you have been able to profile some solutions. Moving further to my next. What can you say, just briefly, to that vexed question?
Okay, so from where I sit, when it comes to nursing administration and management, I'll give it between 70 and 80%. Yes, we have the policies, we have the strategic plans there, but we have issue with dissemination. And I think that though we have those things, if the end users are not taken through one by one to know how they should go about in achieving those things, we will not get anywhere. That is a gap. Number two, we have to go now beyond the basic supervision and do combination of critical thinking, people skills, and then technical skills. So if I say critical, all of that should have a broader vision. It should have a broader vision whereby, for example, let me use if it's an issue in your facility, when you take it, you should relate it to the national health objectives in the strategic quality manual so that you'll be able to overcome all infection or spread of infection in your facility. So we need a broader view when it comes to management. And then also in the administration, this is something that I think Director is here and I'm talking to her straight. Director, it has come to a time where the directors of nursing should have a proper deputy. A proper deputy who also will be in administration. Because when we are talking of administration, clinical side will come in before the administrative aspects. But we just can't, it's only nursing that they will just pick a CNO at any point in time to go and act in the stead of the director. And I think it is not helping. So we need a deputy to take up that mantle. Because we have a lot of it. Please clap for me. Yes. So director, when you were inaugurating the book, you mentioned 2026. So by the end of 2026, we need that document. Let us get a deputy so that you see to this clinical and administrative issue to support the director. And I also want to say that it has come to a time where we need to make good use of technology so that wherever you are in administration, you don't have 50 eyes to see whatever is going on in every unit. But then you need to know. So let's make good use of technology. What we can do to oversee whatever is going on. Yes, you need to go to the clinical field. And what you will see at the clinical field, you apply the theoretical aspects. So if you're at administration, it doesn't mean that you are only doing administrative work. But let us also remember that our focus is clinical care. And that is for nursing. Because most of our deputies will complain. Why are other deputies sitting in offices and they are not going on rounds? It's affecting the administrative and management work. We don't even know the specific skills of most nurses to put into specific positions to manage that area. We need to know, and we also need to train them. We need to develop a training manual for them and take them through. We are talking about administration. We don't even have a manual.
Thank you.
Let me finish with this one.
I'm just alerting you to.
Yes, we don't have a manual to groom, like a training to people into management position. So there is a gap. So they may go there, but to the extent that we are expecting them to perform, we are not getting. Thank you very much.
Thank you. Thank you so much. Madam Ifwa. Yes, so just to add up to what Madam Judith mentioned.
Thank you very much. The then I was head manager from 2008. Just sent to a district hospital to be the head of nursing. What do I know? What do I do? No job description, nothing. So with your knowledge from school, you struggle. You do everything. Whatever you do, there is no standard for you. There is no document. Nobody is coming to assess, do this, do that. The now with the director now. Then we started with the nursing. So you can tell that nurses should do this and this. The nursing audit came. Then we can say that even we are not there, this and this is what we are looking for. Now the building blocks are in. That is directing us. Recently, there is setting a standard for checklists for facilities using the building blocks. And what has happened, then you pick those things you were not doing. You pick it one after the other. Organogram. Then yes, my own organogram. Then it can be reviewed. Then the units. So every unit, try and set your own organogram. Every small ward in charge, set your own organogram. That is one thing. But for every other thing, you see that now we have a standard we are following. Now nursing management and administration is becoming better because we know what we are looking for. We have a guide, sort of, that is leading us. So I think for me, then now we have a brighter future. Thank you.
Thank you very much. Let's move a little further.
Yes.
So, Madam,
Okay.
we are moving to the next one. We have heard this. You may just comment a little on that, but then look at what should be the important thing for nursing and midwifery leadership to evolve beyond the traditional supervision or supervisory role into strategic management and systems leadership? You may just have a comment on what has been discussed previously.
Yeah, okay. So, like other speakers said, nursing management has become better. Initially, when you are put into a position, maybe you may learn from your predecessor. You may pick up the wrong things or the good ones. You would practice that. But there's no uniformity across, because for one region, you are in one region or your facility, what you may be doing, thinking is the best practice, may not be the best practice that is being done in another facility. So with Director of Nursing and Midwifery, bringing up new guidelines for the service is a laudable idea, because it would whip out, all of us into line, and accountability will help bring us the best in each and every one.
Thank you very much. In fact, you just touched on one that I was moving into.
Sorry?
I said you just touched on one of the things I was moving into, and that's laudable. Thank you, Madam. So we've just talked about developing guidelines and protocols. What do you say about nursing and midwifery guidelines and protocols?
Nursing and midwifery guidelines and protocols are so important. There's this school of thought that says, one says that leaders are made. On the other hand, it says leaders are born. So looking at the two scenarios, whatever it is, you need to have some guide, some qualities before you could move or become that epitome of leadership that we are requiring. Now with these guidelines, for example, initially, once staff nurse, nursing officer, SNO, you are looking towards becoming the nurse, ward in charge, and then you move along that line. Like the previous speakers have said, you enter into the administration without any form of training or any idea what you are going to do. And so the essence of the guidelines and protocols is a guide to help us. So even if you choose the other side where leaders are born, so you have the qualities. As a leader, you still need to have something to guide you, to support you, so that you don't stray off the national line and then do anything that you want. So the guidelines and protocols are so important, because you can't live in isolation. You can't be in your facility doing whatever you think is best for you. Now, if Director Nursing asks for a report, end of year report, there is a guide. And so you know that you have to go through, write a report according to the building blocks. So if it's administration and management, you know what is expected of you. If it's clinical practice, you know what you are looking out for. And so the guidelines is so important. We can't live without it. Nursing is evolving. Each day there are new things coming up. In practice, management of clinic cases are changing. So if we don't have these guidelines, we don't have these protocols, we'll always sway away and get into trouble, leading to these medical, legal issues and things. And so we need to take it as our Bible.
To quickly, I'm not cutting you, but to quickly add, do we have to revise the current guidelines and protocols in place? Are they serving the purposes for which they were put in place?
Yes. Every guideline or protocol at a certain time, I must say, would expire. For example, we launched these guidelines yesterday. It has a timeline. The essence is time change. Now, AI has come to stay. And we need, so if the previous one has no guidelines as to how we use AI, the next one you need to put it into it. Some of them will still keep, but others would have to build on. Because it's not a straight jacket, and it doesn't fit all. So as we change, as we evolve, now we have nurse specialists, you get it. And so we need to know how to, I don't want to say manage them, but how to incorporate them into the current system where we were not used to them. Now they are coming, they are in. Initially, we understood that they were going to have consulting rooms to practice. On the other hand, too, we expect them to be at the patient side to help us, the rest of us, manage the patients well. So if we don't have how to manage them, guide them, some guidelines for them, at the end of the day, we wouldn't see how nursing is progressing in Ghana as a whole.
Thank you very much. Madam Stella,
Yes.
what do you think are some of the difficulties when it comes to this implementation of guidelines and protocols? As haven't said, there are evolution in the nursing and midwifery training. We have the college now in place, and some of these things we have not been able to harness properly. What should we be doing? Yeah.
She's Joyce. I'm Stella.
Sorry.
All right, thank you very much. Before I go into the guidelines, I want to add a little to the traditional leadership. You realize that most of us are used to the traditional leadership where we go rounds, we just look at the documentation, we just look at what the nurse is doing, how is the place, and then we just move on. We are moving away from that. We want a strategic leadership where nurse managers, when you go on rounds, you come out with some information or data that will help you to inform a decision or make a decision on what to do next. With the guidelines, we have the guidelines, but it's sitting somewhere. The difficulties are one. At the regional level, even the things to work with, resources are not available. There are times even the CNMO cannot even move. We have resource challenges. We also have human resource challenges. Getting the people to even understand the guidelines. The guidelines that we have are a few from the Office of the Director Nursing. There are a few. So even if you go down there, they don't even have the guidelines. Those who have, they don't really understand. So there is the need for us to do some CPDs, trainings for them, but the resources are also a bit of a challenge. Then and again, the human resource, you train and they leave. Those that even understand, you train them and the next minute you go there and they are going to school or they are also somewhere else. Then and again, we also have a challenge of IT. Most of us are not well equipped when it comes to IT. And I think we need to also learn and then move on. Or maybe at the office of the nurse manager or the unit head, there's supposed to be somebody who can really help us to move on when it comes to the IT, integrating the IT into whatever we are doing.
Thank
you very much.
Thank you very much. Madam Ifwa. Yes, so we're looking at nursing and midwifery practice when it comes to the 24-hour management, as in the block duty and the general night superintendent role. What's your take on the block duty? Is it serving the purpose for which it was carved?
Yes. We underplayed it at a time, and we didn't really value it much. But recently we had monitored, the CNO came and spoke about the reporting live as and when they are on duty. And that has changed the perception of the block duty. So now you are on block duty, we've created a page, including the medical soup, the administrator, and one or two people. So when there is issue, when we have closed on weekends in the night, then you are able to put on the page, there is no water, the limbs is off, so it gives everybody an idea. You don't wait and at the end of the week you go for management meeting and say, oh, over the weekend this was not there. So it is still serving the purpose, because most managers don't come to work. We are not available in the evenings, in the night, and on weekends. You only come during the day, and most times when they report, things are past. But it is still serving the purpose, especially doing it live and incorporating everybody to know what is going on at the time. So the only issue has to be with the reporting, the data collection, where we are writing the big book. So it will come in the IT, where if we have a template, we have developed a form where they fill this number, the ratios at a time. So you can able to tell at a glance, looking at your tables, looking at whatever it is. We also look at the other units as nurses. We still look at the lab, the pharmacy, all those areas. Did they come? Were there issues? So we report we give a holistic report. But if there is a template where we would enter, then collecting data every day becomes easier. Because the writing and every time and the book getting torn, the book is so big to carry around, is becoming an issue then.
Thank you very much. Yes. Let me just dovetail it into the relevance. As in, should it be the nurse manager's role in all that?
Yeah. Okay, so to add to what she said, the template she's talking about, for my facility, now the LIMS is not working, but before, there's a template on it. I think it's on all the LIMS platform. So you only need to let the IT activate it for you, the night soup, especially the night soup one. And the template can be done and put in the system, so that for those doing the day duty can report there direct. So in the nurse manager's office, in the morning when you get to work, after your rounds, you can access it directly even before you go on rounds. The night soup on, you also find it there. Once it's activated, you find it on the system, and whatever lapses there are, you can correct it. The same goes for handing over. When you are handing over and taking up, there's also a template there that they need to write in it, type into it, and things will be ironed out. For the relevance to the nurse manager, yes, it is. Because you need to know what is happening in the facility at any time T, so that you can manage the facility well. Not maybe your director or someone come to call you and find out that, do you know that this is happening? at this place. Once all those things are inputted into the system, or even if you are using a notebook to write, you'll be apt about it and you will know what is happening in the system. You use it to collect data for better management. So it's very relevant to the next manager.
Thank you very much. Madam Judith, I want to have your take on the next meet documentation. How relevant is it to the nurse midwife manager at all levels?
Okay, so where I'm coming from, we are not using nurse mid. So let them take it.
They say they can't hear you. No, can you explain why it is not utilized?
She said they are not using the nurse mid.
No, I wanted to say something about it. They cannot hear you.
We don't use nurse mid.
What do you use as a model tool?
What do we use?
As a model tool.
As a tool?
Yes.
Okay. So our system, our electronic medical records has an inbuilt template. So we normally input metrics in based on what we want to see and what we want to know and what data we want to use. So it's like every decision that we take is data driven. So we check in the nurse meet and it has been made available to everybody. So even where I sit in my office, I see what is going on. So we come out with our metrics and then we input our metrics. So when you take their nurse meet, there are certain things they have that we don't use. But ours are different, yeah. Thank you.
Thank you. We may have to visit you and leverage on some of the things. Thank you very much. So we are looking at the management of medical consumables available and related issue to quality reporting. What can you say about it? Hello? Are we here?
Yes.
Are you engaging us? I'm sure we are not having meetings within a meeting. Thank you very much.
Okay, please the question again.
Say again.
The question again.
Oh, okay, thank you. I'm talking about medical consumables. Its availability and the quality of reportage vis-a-vis a nurse midwife manager. What should you do to leverage in that aspect?
Okay, thank you. When it comes to medical consumables, you as the nurse manager, you should be on top of all the issues. You should know what is even available at the stores. The usage. As my sister was talking, they have a system where at her office you can see everything. The same way some of our facilities also do, but others don't have. So every week, you realize that we write requisitions, we request for items that we are going to use. And we are supposed to make sure that we break even. We are not supposed to, we are not making profits, but we have to account for the things that we have collected. Nurse managers should know whether the things are there or not. We are having a lot of challenges when it comes to logistics. Some facilities even don't have gloves to work with, all because of our planning and other issues also. If we plan well, as a nurse manager, you are supposed to make sure that the resources are available because you are managing human and then material resources. And then you are supposed to make sure that you report If it is not there, that is why you also represent the nursing fraternity at the management level. So at the management level, you should be able to report what is there and what is not there in order to make sure that things are there to work with. Thank you.
Thank you very much. Madam Stella, what would you say about the quality of the consumables we use as a nurse manager regarding facility resources to make them available?
Yes, I must say, when it comes to consumables, we sometimes have issues. Per the, some facilities,
In fact, what should be the role of the nurse
Yes.
midwife manager?
I'm coming. Yes, I understand. In some facilities, nurse managers are not made part of the procurement team. And that is a very big.
Madam Stella, I just want to throw in a caveat here. I am aware that some nurse managers may not be made part of the procurement team, but there has always been a representation. And so, I think the representative is the mouthpiece of the nurse manager.
Okay.
Hello? Hello? Hello?
Yes.
Okay, suffice to say that we are not accepting, because the nurse is the end user of the consumables which are procured. And if you don't have, suffice me, if you don't have a representation on the procurement team, then it means you are shortchanged. We can discuss this further, but I'm putting this to you that it is a space that we should accept, because at the end of the day, the quality of care that we give will be the adding of the nurse midwife. Thank you. Let's continue.
So what happens is, even if you have a representative on the team, sometimes we do choose the best or what we think is quality for work. But then, when the things are being procured, depending upon the management team, you know, within the Ghana Health Service, since I started working most of the time, these things are done between the administrator and the MEDSU. They have their suppliers they pick things from.
Hello.
And so there are instances these materials are brought, and they are of inferior quality. About 2 or 3 years ago, at one of the mission hospitals in Ahafo, 3 patients had cannula detaching, the plastic detached from the holder. And they had to do surgery to remove them before the hospital agreed that those things should not be used again. Meanwhile, they believe we have BP apparatuses which are not good. And we keep telling them that we don't want this. But because sometimes it becomes something else. These are some of the things that affect the quality. And then the storage. When we get them, how we store them is another issue. You go to some of the wards, we don't have cupboards or storage units. You put the things in, they are lying on the floor, mice are all over, they are chewing this, the packaging. And so the storage is one thing. Now the usage itself, if we don't plan our usage, we make a lot of losses and then wastage. I don't know if I've answered.
Thank you
because I love
very
the
much. For sake of time, we will be wrapping. It's unfortunate we do not have much time, but I want to pick your thoughts, all of you, briefly on, starting from you, on this. The rationale in staff ratio, development of duty roster, workload, the planning of leave. Just briefly, and then you pass it on. The rationale on the ratio of the nurse to patients, duty roster, reliefs, the workload assessment, and planning of leaves for nursing and midwives.
Planning of leaves, ratios, duty rosters, they are so important. Currently, with this issue of exodus of nurses and midwives, if as a nurse manager you are unable to plan, and then first of all at the end of the year you plan where you are placing, taking into account the staff mix, then you have shortages along the line, you will be unable to correct them. You need a leave rosters again to prevent burnout. We are supposed to have rest.
At what time should that be entered?
Leave rosters are planned at the beginning of the year, when you know your staff strength. So what we do is every unit would prepare theirs, and then collectively they are added together. Then the nurse manager, you know that for January you have this number of people leaving and this number of people coming in, so that you can plan when there's any shortage. You can quickly pick one from another unit or someone coming in from leave to go and support where they have shortages.
Thank you very much. Let's hear from the next speaker.
Yeah. So like she said, the leave roster is planned at the beginning of the year. You plan, each ward plans when the staff is going on leave. So when they bring their monthly duty roster, you need to check and make sure that the number of people going on leave have really been taken off the roster. Because some cases, the person may choose, let's say, February. Along the line, they will decide not to go. So you find their name on it. So they will all try to push it towards the end of the year. That creates artificial shortage in the system. So you need to insist on their monthly timetable, that those who have put up their name to go on leave, let's say in March, follow the leave roster to the letter. Unless they have issues, they come up to the nursemaid administration to trash it out. Then you can make it flexible for them.
Thank you.
Okay, so with the ratios, if you are able to tell the nurse-patient ratio per shift, then the leave also even comes in, that these are there to help you to know the number of nurses you need within a unit, the category of staff you need within a unit. It also helps you if you are asking for more nurses. I'm asking for this category of more nurses because there is shortage here. When we draw the ratios, it's only 2 enrolled nurses or 3 enrolled nurses per shift. Then you don't know what to do. So it helps with policy makers taking decisions at even the national level. The rosters, the leave also deciding that if we have staff nurses, we have nursing officers, we have enrolled nurses, when should they go on leave? Then a staff nurse, depending on the number of people in the unit, a staff nurse can go with an enrolled nurses, but 3 staff nurses cannot go at a time, or 3 staff nurses will not be able to go at a time. So generally, the rosters, the leave, and the shift helps us to identify the mix that we have at a time, help with decision, help with even asking for the number of people, the nurses we need, where a standard will come at a time that for this unit, this is a standard of nurses, such that if we don't have, are we asking people to come to, they will be paid. Then with time, just like they do outside, we will know the number of nurses per unit or per shift for each unit.
Thank you. Thank you.
Okay, so we use the leave rosters, all right, and we also use our duty rosters. We give rooms for excused duties. So also we have our normal patient ratio, nurse patient ratio. So with us on the general wards, we maintain 1:4 because we do individual nursing care. We share the patients. ICU, we do 1:1. And so on my dashboard also, I'm able to see where we have more patients and where we don't have more patients. We reassign nurses to various wards. And I have also created seasonal nurses. They are nurses that I call in to assist whenever there is shortage. And I do an internal locum, and then we pay. So when it comes to staffing, we are okay. Thank you very much.
Thank you. Thank you. Yeah, you can understand her.
Okay.
Where she's coming from, you can understand her. Thank you, thank you, thank you.
Okay. Yes. For me, I would say that
Continue.
Ghana Health Service, we are quite different from where our sister is coming from. But we cannot do things the way we were doing it now. Looking at, previously we were doing our rosters, we start leave planning every year, and then you paste it there. You don't want to change. Now it's not like that, because as the year is going by, a lot of people are leaving the system. You will have people going to school, they will not even tell you. You, the nurse manager, you are there, and by the time you realize, you go to the ward and they are in school. So now we are looking at strategic planning, where you are going to, you have to look at the number of staff you have. And at a point in time, you should also look at how best you can use the human resource that you have available. When it comes to the nurse-patient ratio, at times it's difficult for us to even calculate. We are the regional offices. At times we receive the staff ratio and you look at it and it's like, is it really the correct one? Because we are stacked. The work overload is something else. We have to also look at the skill mix when it comes to this duty roster thing, the leave roster. Now, they are supposed to choose their leave any time of the month. You cannot do anything about it. They can take it maybe 2 weeks, 1 week, and all that. So if you are planning at the beginning of the year, at times it becomes difficult. But we need to do what? Plan as nurse managers. So going forward, as we are living here, I want all of us to also take note of all these, so that when we are planning, it will help us. Then
Thank you very much.
Can I add,
unfortunately, we don't have the whole day, and so we may have to take some of them.
Yes.
Add it on.
I just want to say that for what I was saying, is this standard we want to have in all facilities, where we are saying that there is this number to this number of patients. When there is shortage, then we need to get people, are they paying as locum? Because for PAs, for doctors, they bring people as locum to stand in. So what are we going to say? Because we are supposed to be 20. 10 have left some are on leave, and the 2 are still managing the 20 patients. How do we move forward? This is the standard we want to set. Thank you.
Thank you, thank you, thank you. Shall we give them a round of applause? Yes, I do. So, where's my MC? We need to pick up Yes, my understanding is that we ought to have had some time to have the feedback. Unfortunately, we are not privileged by time, and so we may have to skip some of them for other sessions. So on this, I would want to thank the panelists for availing themselves and sharing with us the knowledge that they have acquired all this while. Shall we give them a round of applause? Thank you very much. Thank you, thank you, thank you so much. But I have a few observations. You know what? For us in the regimented institutions, a session like this would have taken us for an hour or more. Because we say that Master say, make a say. But this one, I don't have a say. And so I go by what our Director 1 says. So, what do I have to add? It is said, and so true, that strong nursing and midwifery administration and management are not optional. Are they? They are not optional. They are responsibilities. The same nursing and midwifery is a feminine dominant profession, right? But is it feminine dominant knowledge and wisdom? Thank you. So I would urge all of us to accept ourselves wherever we find. It is essential to translate policies into quality care, and that investing in leadership, systems, and innovations can build a stronger nursing and midwifery profession. We cannot do less, and our leaders should ensure that we are empowered in that direction, and so as to lead the transformation towards a more responsive, efficient, and people-centered system. I have a few questions. I know my MCs are ready, but you know, those of you who are close to me will tell that until I'm done, you have to drive me away. I have this. If you could make any one policy or structure a change to improve nursing and midwifery administration in Ghana, what would you do as a nurse midwife manager? Go home and think about it. Increasing funding for national education and training programs. What would you do as a nurse midwife manager? What short-term actions can you take within the next year or two to strengthen management at the facility within which you supervise as a nurse midwife manager? Developing a succession plan and a framework that would endure or otherwise stand test of time as a nurse midwife, what would you do? And providing ongoing education, development opportunities for the younger ones on which we would want to leverage in the future. What can you do as a nurse midwife? What message would you give to the current and inspiring nurse midwife who are next after you? And how can you empower them to be able to give the quality care that we endear to ensure that there are better health outcomes? Must we always be the suppressive managers or leaders? Ask yourselves, why are they treating us the way they do? Is it not emerging from our attitude towards the younger ones? We call them Gen Zs. I call them Generation Zero. Leverage on that. Thank you very much for indulging me. I'll be with you once more. Joey, unity, unity. The police is your friend. When you misbehave, I will arrest you. Thank you very much.
Thank you so much. We will be having our second panel discussion pretty shortly, but before that, we will have an introduction to the school health services, and that will be done by our very own Madam Gifty Ben-Ayi. Please let's give her a round of applause. Oh, she's looking so beautiful. Let's clap as she's coming. So sorry, Madam Gifty will be doing this together with the panelists. So I would like to invite our moderator, the Regional Chief Nursing and Midwifery Officer, Eastern Region, to please come and take over. Please let's do it better.
Good afternoon. I was just asking whether it's morning or afternoon. Okay, so thank you so much for having me and for this opportunity, Director. We are going to talk about school nursing services shortly. And I would like to introduce our panelists before the presentation, so that right after the presentation, we can pick it up from there. So to join us on the stage, CNMO for Greater Accra Region, Madame Vivian Drea. Oh, please give it to her. Then CNMO Central Region, Madame Margaret Samson, sorry. It's Samson. Nyako Samson. She said I should add the Nyako. CNMO Nyako, yes, Samson. Thank you for joining us. Then we have Madame Akosia Ousua. She's a school health nurse, Central Region. Please give it to her. Hey, special one. All right. Akosia, that's for you.
Okay, so our program manager for midwifery has been introduced already, Madam Gifty Ayi. She'll take us through a short presentation and then we'll take it up from there. Okay. So I think I've left one person out. We have a Ghana Education Service representative. She is the School Health Education Program Manager, Ghana Education Service. She will be appropriately introduced by Sister Gifty shortly.
Good afternoon. So we are joined by the Director, School Health Education Program from the Ghana Education Service, Madam Teresa Opon. We are doing this in collaboration with Ghana Education Service, so it's appropriate that we have their representative here. So I'll take a presentation that spells out the direction when it comes to school nursing. So you're looking at institutionalizing school nursing in Ghana Health Service. And so we'll have the traditional school health education program that is led by the Ghana Education Service, and Ghana Health Service provides technical support through the reproductive and child health departments. But in 2018, Ghana Health Service together with Ghana Education Service signed a memorandum of understanding that we would assign school nurses to run school infirmaries because they had done an assessment and realized that there were gaps and there was the need to streamline how health services is provided using the school as a platform. And so this is a special purpose vehicle that looks at instituting nursing services or nurse-led health services in the schools, especially the senior high schools. And the target is to ensure that we are safeguarding the health of our pre-tertiary learners. When we talk about pre-tertiary learners, Madam, correct me if I'm wrong, from KG up to, I think, SHS. So the school nursing services is supposed to cover from KG to SHS. Currently, when you look at work that has been done so far, Ghana Education Service gave us some statistics when it comes to the number of SHS and the number of TVET or technical and vocational schools. We have 938 senior high schools and TVET schools. And out of this, we have 445 having school clinics. And so there is a big gap that needs to be filled. And we are going to do that in collaboration with the Ghana Education Service. We have assigned 704 school nurses. The regional breakdowns are there. We would give it to you in due course. And when you look at the statistics, it's obvious that majority are females. And some are staying in the schools. Out of the 704 school nurses, we have 109 staying in the schools. And 595 commutes from home to the schools. Globally, school nursing is a specialty. So when you look at the North American guidelines for school nursing, it is part of their nursing system. They write licensing exam. We did some global research in terms of the literature. Look at Canadian system, we look at the UK system, and then the American system, as I said. School nursing is a specialty. And so you finish your basic training and write a licensing exam to be assigned to a school to manage their health needs. But here in Ghana, it's not so. We don't have it so structured. We post nurses to the schools without any training. I remember when we started, the policy that was guiding us was that we are supposed to assign only professional nurses, RGNs. But when we collected the data, we realized that we had ENs and RCNs. And HR was questioning us because per the scope of practice, they are not supposed to do some things in the schools. We can get away with things if nothing goes wrong, but if something goes wrong, we will be taken on legally. And these days that we have our own practicing esquires, they can find some loopholes in what we are doing and then take us on. We have had reports of students dying, and when we go into the investigation, it's very sad. The reason why we started this program was when we lost a student at Kumaka who had a stomach ache, supposedly. He went to the clinic, and then the school net had closed. And so there was a teacher who said, okay, lie down, let me give you something, because the school nurse had handed over the infirmary to the teacher. The student died. And we've had countless times to witness some of these things because we haven't put in place the needed structure. But must we continue to let our students die before we come and constitute a committee to actually look into the cause of death? I think it would have been too late for us. And so our director's direction is that we put together a special program known as the school nursing program. So we'll be riding on what is done in other countries, but we'll adapt it to suit our context. So we may not write licensing exams, but we need to put in place some form of CPD to make sure that our nurses have the right skill before they are posted to the schools. Yesterday, we launched our strategic plan, and before that, our director made a presentation on our building blocks. And so the school nursing program is going to be integrated in our building blocks. Whatever we'll do, we'll make sure that it aligns with our building block. Please kindly go forward. So for the ODNMS office, we are looking at operationalizing and testing a model. Currently, we don't have a clear model in mind because different regions are doing different things. And so we are proposing a model that seems to bring everything together, and we'll test it. And what we'll be doing is that we'll be providing the guidelines, and we'll be providing the standards together with the Ghana Education Service. And we are going to make sure that we don't duplicate efforts. And so the traditional interventions that are run by other divisions will go on. So you have adolescent health, you have the NCDs, you have HIV in schools, HIV programs in schools, you have girls in iron folate tablet supplementation program, and then you also have recently the newly introduced HPV vaccination program, which also rises in the schools. It's going to go on all right, but this particular institutional arrangement would be under the office of the Chief Nursing and Midwifery Officer. And so she leads the entire scope of school nursing. And then the other interventions would be integrated into it. I remember when we started the engagement with our chiefs and our regional public health nurses, there were concerns that our chiefs will take over the work of our regional public health nurses. For that discussion, I will leave it to my director. I'm too young to pick up that discussion because we may open a Pandora box and I may not be able to answer. But what I know is that if we understand the model, we should be able to work together, build or leverage on our individual strengths. So whilst the regional public health nurse is still going on with the traditional school health services and then the adolescent health services and so forth, we also have the nurses who are stationed in the schools who would also be working. And so hand in hand, they all report to the regional chief nursing and midwifery officer. Please, there's a model that I want you to project. Operator, so if you can project, we'll share this one on our platform. It doesn't look so legible here, but in the model, you realize that we have spelled out what our focus is. Our focus is the inputs being the guidelines and standards, the professional development and data-driven capacity of our school nurses. Go to some places, they don't have the tools to collect data. And so you ask them, how many students did you see this year? And they can't tell you. Or you ask them, what are the top 5 conditions that you have addressed or you have attended to? They can't tell you. And so our office is working to make sure that there are tools that are available. And we've been talking about digitalization since we came here. And so we are working with the ICT department to implement the school health information system, which has been rolled out in some schools for, I think, since 2023. And we have introduced our chiefs to the school health information system. And I know that plans are underway to integrate it into our reporting channels. The processes will be the interventions from our various divisions or departments in Ghana Health Service, which will be trickled down to the district. And per outputs, we want to ensure that we have trained nurses before they are posted and our school clinics are functional, and that we have the routine data to inform us when we are taking decisions. We'll share this presentation with you so that we don't take the wind out of our sail. So for our group work, we are going to be validating guidelines which we have developed to help us with the strategic direction for this particular initiative. And so as you move into your groups, let's have at the back of our mind that this is a streamlined or a harmonized arrangement between what we are doing currently and then what we find some facilities also doing, posting nurses to the schools. So we are bringing everything together under one umbrella. And so when you look at the documents, try and look at it with that lens, that we are all going to work together. We are not going to be working in silos. Thank you very much.
Thank you very much, Sister Gifty, for that presentation. I think with this presentation, at least we have a fair idea of what we are going to do this afternoon. Okay, so we'll be discussing school health services. Why is school health service important to us as nurse managers? If you look at the population of schools, even in SHSs alone, each year about 500, we have a representative from GES here, she will correct me if I'm wrong, but from the little research I did, more than 500,000 nationwide are enrolled each year. It means that at each point in time, if they are to stay in school for 3 years, we have about 1.5 million students in school, in SHS alone. And if I say alone, I'm talking about just public facilities, not even the private. So that's a huge figure. If you compare it to our 34 million population in Ghana, we have about 4-point-something% of this population just in the public health facilities. And to think that, like we heard yesterday, about 62% of these schools do not have school clinics or infirmaries. It's a cause for concern because majority of this population are in the boarding houses. So if the schools do not have infirmaries, what happens when there is a health challenge? And we know that most of our students are also living with chronic illnesses, just like the adult population are doing these days. So what happens? So this is where points I want us to be thinking about even as we start discussing this. So I've already introduced our panelists. We'll go straight to the discussion. Thank you very much. So we'll begin with Program Manager Sister Gifty from Director of Nursing's Office. You talked about policies on school health. To what extent, so first of all, I would like us to discuss what is the content of the policy? What is it saying? And to what extent is it being practiced on the ground?
Thank you very much. When it comes to policies on school health, its development is led by the Ghana Education Service. So normally Ghana Education Service will lead the drive for a policy to be developed. Then Ghana Health Service will then provide the technical support. So we take what is our role in the policy and then we translate it into guidelines. And so hardly would you find Ghana Health Service developing a school health policy. So usually it's done jointly with the Ministry of Education, who happens to have an implementing partner as the Ghana Education Service. We know that the Ministry of Education through the Ghana Education Service has a policy. And I think that when it gets to Mrs. Sopons, she's going to talk about that. But in Ghana Health Service, we have translated them into guidelines.
Okay.
The first guideline that came out for school-based health services was from 2018 and 2022. So that is what is giving us the impetus to bring out with new guidelines. And so before we came out with these new guidelines, we had to do the assessments and find out how far we have come. What are some of the successes that we have chalked over the years? What can we roll over into the future, and what can we improve? And so we are taking care of all of that in these new guidelines we are going to be validating.
Okay.
And so I'll leave the policy bit to Mrs. Opon to talk about.
Mrs. Opon, okay, so before you come in, just a follow-up on what you just said. So if this started, the guidelines were introduced from 2018, between 2018 and 2020. Before then, school health services have been in existence for so many years. What were we doing? Or what was guiding our practice?
So before then, the Ghana Education Service had a school health policy. Even before we came up with the school-based health services policy. So I always want us to separate the two. So we have the traditional school health education program, which is like the umbrella of everything that is done in the schools. For that is led by the school health education program at the Ministry of Education through the GES. What we do at Ghana Health Service is to provide the technical support. And so we had guidelines before we had the 2018 that gave us some strategic direction to translate what they told us to do.
Thank you. So there was some guideline.
Yes, please.
Okay,
Yes.
Thank you very much. So please, I'll move to Madam. On the policies, please, if you can enlighten us on it.
Thank you. The name is Teresa Opon Mensah.
Opon Mensah.
Compound name. Or Teresa Mensah. My maiden name is Mensah. I got married to Opon Mensah. So any of them, I still respond to.
Okay,
Thank you.
That's interesting.
Like Gifty indicated, we have the school health policy, and that is guiding all the interventions that we have for our schools with support from Ghana Health Service and other NGOs. And she mentioned the sick bay, so let me also add that the sick bay is one of the strategies that we are using to implement school health within the school. Aside that, we have other approaches like the school health club, and there are health promotion services also that are provided with the support of nurses and other staff that we have within GES. And she indicated that the guidelines was based on the school health policy. Let me add that currently we are reviewing the school health policy. There have been a lot of changes within the system, so we also need to respond to what is happening now, and so it is currently under review. Let me just add that it is unfortunate when we ask for somebody from Ghana Health Service, we see different faces. So the person who started with us, you don't see that person in the next meeting. And that is a big challenge to us, because those who are familiar with what really goes into school health are not the people we are getting when it comes to the review of the policy. It's almost done. Currently, it's with the minister. We are waiting for the minister's approval, and then we take the necessary to see to its finalization.
Okay.
Thank you.
Thank you very much. I was going to ask that whether you involve Ghana Health Service staff when it comes to this. So that's a challenge. And then, does it affect the decision-making process in any way if the people are changed? Because probably I'll be in office today, tomorrow I'll not be there, but somebody else will still have to sit in.
The technical people that we need, sometimes we don't find them. We understand you also have field activities, but we have had one situation where we had a secretary representing, and the secretary may not be so familiar with what goes into the school health services, and that is where we have the challenge. Yeah.
Thank you very much. Our school health nurse, Madam Akosia, just give us a brief overview when we say school health, for the sake of those who might not be too at the clinical side. When we say school health nursing, what is it, and what are your roles as a school health nurse?
School health nursing is more of having nurses in the school who render services to the students and in the school environment. So the infirmaries, though it's situated in the school, is not being attended by only students. You have the staff and their, let's say, relations on campus coming to the infirmary. So the professional nurses who are situated in the schools render these services, both clinical, preventive, and promotive services when necessary. Then with the rules, a school health nurse, I've already spoken about the preventive and the promotive. They perform assessments. So usually before school begins, there are screening services being done. And a school nurse is part of the screening process. They help in early identification of any disease that may be developing within the students. They also coordinate in setting up clubs, adolescent health clubs in the school. They help in training peer educators. Our students usually rely on each other for more information. So usually you train their peers and they tend to listen to them more in most of the times. Then they would also facilitate prompt referral services when needed.
Thank you very much for that. CNMO Nyako Samson, please, is there anything you want to add to the rules that she has mentioned? And what do you think is the role of the nurse manager in ensuring that these rules are carried out promptly, as it's supposed to?
To add to the roles of the school nurse, they also give education on current public health issues. Like recently we had in Central Region, some of our schools had an outbreak on influenza. So they give education on current public health issues. Then also, she mentioned referrals. They give minor ailment treatments. Then they also give education on non-communicable diseases, because some of the children have non-communicable diseases. Then for the role of the nurse manager, some of the schools are linked to facilities. So the nurse manager is supposed to provide regular supervision. She's also be the advocate for the nurse in the school. Because sometimes you realize that even the schools sometimes don't understand the role of the nurse in the school. So they give the nurses certain roles that she's not supposed to. I remember one of my school nurses called me and said that the school is saying that whenever there should be a referral, she was the only one there. So the school insisted that when there's a referral, you have to go with the the referred case to the facility. And it was a challenge for the nurse. So the nurse manager should be the advocate for the nurse. And sometimes she has to visit the school management and let the school management know what the nurse is supposed to do in the school. And also ensure that sometimes school management don't involve the school nurse in some decisions, even concerning the infirmary. So the nurse manager should ensure that the school nurse is always part of decision making concerning the infirmary.
Thank you very much. Yes, so we have also heard from the presentation the type or the category of staff that we need at the school infirmaries. But per the presentation we saw yesterday, we have more of the enrolled nurses in the system than the registered nurses that we need at the school clinics. CNM Odra, you are coming from Greater Accra region. So majority of the schools in Ghana are in Greater Accra. So what are some of the challenges you face when it comes to staffing?
Thank you so much. With regards to staffing, I think it's a bigger issue. Yesterday, our Director of Nursing and Midwifery Services presented it, that we have a lot of unprofessional nurses, more than the professional nurses. So deploying staff to the various institutions, so that is the schools, becomes a problem. Here is the case: you have divided attention as to place professional nurses at the facility level, and at the same time the secondary schools or the schools, the school infirmaries or the sick bays. So if you don't have enough professionals, you are forced to blend with the non-professionals. So currently, as we speak, we have enrolled nurses, we have RCNs, and we have RGNs also placed at the school nursing or the school infirmary.
Yes, so are they adequate? We need RGNs more.
Yes.
Preferably.
Yes. So some of the schools, looking at the population, we are supposed to even have at least 3, so that there will be 1 resident who will run night shifts. Then the 2 will also run shifts, morning and then afternoon. But because of the challenge that we have, we cannot have the 3 that are placed there. So currently, some of them are having 1, some are having 2, which I think is not adequate. When one is on annual leave or sick off, there's nobody to replace the person. It means you have to force yourself, look around, scan through, and then get somebody to be placed at the school infirmary or sick bay, which I think is a challenge as for Greater Accra and even as a nation. Thank you.
Thank you very much. Akosi, I'm coming back to you. What are some of the challenges that you face? You want to know the real challenges on the ground as a school health nurse.
As a school nurse,
apart from the staffing issues that we talked about.
So there are issues with students using NHIS, financial issues. So most of them have the NHIS, but they are unable to use it in the school setting. And it becomes an additional cost to them. Then there are also issues with, let's say, data. Though we do provide data, but as to whether it is in the appropriate or accurate form, the completeness, we have issues with data collection and the feedback system.
Can you explain that further? What are the issues?
Okay, so with data, depending on where they are they able to do proper documentation? If proper documentation is not done, it would come down to inadequate staffing. Because if it is 1 nurse on duty attending to, let's say, 15 people, most of the schools they don't allow students to keep drugs with them. So they will bring it to the infirmary, and at a particular time, students are to rally at the infirmary, take the drugs, and go back to class. But with this instance, a nurse who is just on duty may have problems even with documentation and even delivering the right care to them, because at that point you would have to do so many things at a time. You are not to interfere with their class activities also. Then there is also issue of accommodation. Most of them do not live on campus, so you would have to move from commute to the school. So as to what time the person gets there becomes an issue. But we know usually sicknesses or students may get sick, let's say at night. At night, who is there to attend to them? It will still be an issue with the school nurse services. Then there is issue with drugs, the non-drugs and drugs issue, who to supply. Sometimes you go to Ghana Health Service or your immediate directors and they tell you there is none. The school also tells you it is free SHS. So we do not have money, we do not have money to procure the drugs for you. So sometimes we have parents stepping in to provide, and the drugs come as and when they get it for you to use. So if they tell you we do not have non-consumables, it becomes a problem for you to work.
Thank you very much. I think I'll come back to Madam Perisa Mensah. Yes, so you've heard, I think one of the challenges I would like you to elaborate on is on the provision of medications for the students, especially with the issue of NHIS. In what way do you think GES can help us resolve this issue with getting medication? Sometimes they do get support from PTA, like she mentioned, or from some parents, but we need a sustainable approach to ensuring that the schools are well equipped. So once we have a general nurse and then she knows her scope and she can handle some of these minor ailments, you see, so how do we ensure that, how do we collaborate, Ghana Health Service, Ghana Education Service, to ensure that the schools are well equipped when it comes to some of these issues?
Thank you. Per the structure that we have, GES is supposed to provide the facility, or let me say the room,
the space,
and then resource that place. Ghana Health Service is supposed to provide the medicine. So per the mapping that we have done, the school clinics are supposed to pick their medication from the mother facility. But then there are instances, as she said, you go there and there are no medication even in the stores. And so the PTA is expected to support. But the question I always ask myself is the school health committee within the school working? If it's working, then this committee should be in the know that this is our stock level, and so we should know, we should have some around to support when there is a need. And then the PTA can come in. But where the committee is not working, that will mean that the school health nurse may be working with the assistant head domestic or the head directly. And so nobody will know what is happening. On the medication again, I have moved to some schools, or let me use my own child as an example. My child visited the clinic, and my child, I was called to pay a bill. And then I paid 180. Then the next semester, my child went to the clinic again, but he has allergies, so he doesn't take some medication. The first one, because of that, I moved in the next day. But usually when I'm visiting secondary schools, I don't use my official car. So I moved in and I wanted to know the medication my boy was given. We combed the whole place. The school has 7 records books. My boy's name was not in any of them. So the medication he was given was not even recorded, yet I paid for. Yes. The second semester, when he went, I followed up, this time with official car. So when I got there, the nurse asked, then I was compelled to introduce myself. Then I said, when you discharge him to go back to the dormitory, let me have the bill. I didn't receive any bill. So I called the housemaster, let my boy go there the next day so that I speak with the nurse. I spoke with the nurse and the nurse said, there's no bill. So I was surprised because you gave out medication. So why is it that the first time my boy paid and then the second time? So the first time I paid, my suspicion was that maybe the school wasn't having the medicine. And so they bought from outside for my boy. And this time, the same thing. But this time, I think the mistake I did was that I went around inspecting the place because I had introduced myself. So these are some of the challenges we have. But medication, even in the school, we say school community. So school community means that the parents have a role, the teachers also have a role. So we all support at the time when there is the need. So if the school is not having the medication, they are paying PTA dues. I also pay. So that PTA dues, can we fall on that PTA dues to provide medication at the sick bay? Recently, in another school in Eastern region, the girl had asthma. The mother tried, because the girl had calling for help, called the headmaster and the assistant said, I am on my way to another place. Call house mistress said, I am going somewhere. Okay, so let the girl go back to the sick bay because she had gone there and she was given paracetamol. So go back to the sick bay, tell the nurse that you want to go to hospital. And the nurse indicated that there are people she is attending to, so you have to wait. She waited till 4 o'clock because she needed to be nebulized. So 4 o'clock because she was sent to the mother facility. At 7:30, the mother called back that I just spoke with the nurse. I'm supposed to pay some amount of money as a bill. Then I said, pay, because you want your child to go back to the school. And the NHIS didn't work over there. That is why she had to pay. So NHIS school clinic, I have followed up on one that was shut down or locked by NHIS official, that they have opened to the community and then the community is using the facility, but the facility is not accredited. And I think that is the problem we have with our schools. That is why they are unable to use the NHIS. So going forward, how do we link NHIS to this facility? They have been mapped to the mother facilities. The mother facilities are linked to NHIS. So if these school clinics are linked to the mother facility, then we should be able to use the NHIS. So I think Ghana Education Service, NHIS, and then Ghana Health Service, we need to meet to address this issue.
Thank you very much. Madam Gifty, do you have anything to say about what Director has just said? Probably headquarters has something in the pipeline in terms of addressing some of these issues.
Very much. So the challenges are known and we have explored some of them. I'll begin with the mapping issue. So under the arrangements with Ministry of Education through the Ghana Education Service, each school clinic is supposed to be mapped to a parent facility. So let me give an example. So if you have maybe a Brie Girls that has a school clinic and a nurse there, the nearby facility may be Tetekwashi or any facility. But we need to make sure that the facility meets a certain criteria, because you cannot map the school clinic to a facility that doesn't provide the scope of services that the school clinic is supposed to do. So once we mapped, let's say, Brie Girls to Tetekwashi, Tetekwashi assigns a school nurse from that facility to man the Brie Girls school clinic. She takes her drugs, consumables, and everything from the mother facility goes to provide services. She's supposed to ensure that students use the NHIS to access services, and then the facility make the claims on behalf of the school clinic. That is the arrangement.
Yes. Yes, so it's just bringing my mind to what I heard this morning before we came here, that is the arrangement, like you have said. But in reality, when they get to the facilities, there's always a challenge with them assessing NHIS. You, Akosia, you are a school nurse. Have you ever had any challenge when it comes to referrals to the mother facilities? With students who have any...
We pick up, let's say, logistics from our mother facility. You are doing it underground without the, say, notice of NHIS. Because when they get to know it, they would stop paying the mother facility for the services you have rendered, because you would have to register in your name. So it's either you are taking the students to that facility so that they know that the person came to the facility. Other than that, when they get to know, you lose your investment.
Thank you. Sister Gifty, any way forward with regards to that, just this aspect?
Yes, I think we need to have a broader discussion. All the stakeholders need to come on board. From the past, what we have done is to engage ourselves, Ghana Education Service and Ghana Health Service, but we haven't actively engaged the National Health Insurance Authority. So the next phase of the rollout of the guidelines is to ensure that all the players who play critical roles in this particular arrangement have come on board. We have shared our challenges and we come up with shared solutions so that at the end of the day, we all know the rules that we are supposed to play, because at such a forum, our rules will be clarified. So we know what Ghana Health Service is supposed to be doing, then we know what Ghana Education Service is supposed to be doing, and then the National Health Insurance Board.
Thank you very much. CNN Jura, I think we've heard about some of the stakeholders. We've mentioned some stakeholders over here. Are there any other stakeholders when it comes to school health nursing that you think we can bring on board to help push the agenda forward?
Okay. Thank you so much. So, as she rightly said, we need stakeholders on board when it comes to school health services. We have GES, Ghana Education Service, Ghana Health Service, Ministry of Health, that we are collaborating already. But we shouldn't also forget that when it comes to our school health services, we also need other NGOs to support. Most of our school health activities are sponsored by our NGOs, that is partners. We have UNICEF, UNFPA sponsoring most of our activities that we undertake at schools. We also have parents, they are stakeholders. Parents, when we are able to collaborate with them during PTAs, we even have our students, some of them have special needs. And these parents, you have to collaborate very well with them for them to give you, for you the nurse place there, to give the parents updates, periodic updates of their wards, because such people, maybe they need their drugs to be refilled. They need to go out for follow-ups, which they will not get it within the facility that it has been mapped. The school infirmary has been mapped. We also need community collaboration. Our school children are within the communities. They also have to know the activities, the policies that are in place for our school children, that is the students. So I think all these people, when they come, even the students, they are also our stakeholders. We need to collaborate well with them, because they are the beneficiaries of school health services. So all these people, I think we need to collaborate with them effectively so that we can give a comprehensive school health services. Thank you.
Thank you very much. My last question to you, CNMO, Yaku Samson. Yes, so we've talked about the two categories of our two approaches to school health nursing this morning. The clinical school health nurse, and then the district-based school health nurse who runs assessment in the schools. How could we bring the services of these two together? Because most of the time, they don't seem to work together because they have different functions and roles. But here we are challenged when it comes to staffing. How could we bring these two, link these two services together so that we have school health nursing as a whole?
I think that in some of the areas it's working, they work together. Because you have the facilities that are linked to the school, and we have the district that is supervising all the activities of the facilities. So the district, being the head, should coordinate the activities of the other facilities when it comes to school health. So for every year we do screening, and the screening is coordinated by the district. And so when it comes to, apart from the screening, there's also supervision of clinical services. Then the clinical services, the nurse managers and the district public health nurses can come together to do the clinical supervision. Because when it comes to screening too, they work with the clinical nurses, some of the clinical nurses. That when screening, we do eye screening, we do ear screening, then even we screen non-communicable diseases. So we use clinical nurses. So the clinical nurses and the public health nurses should come together as a team to do the work.
Okay. They should come together as a team to do the work. So we are coming from different regions, different districts, and we also have our own experiences when it comes to school health nursing. And we've also been, some of us have children in SHSs, and even as we talk currently, and we know some of the challenges we face. I have been called a few times when my children were in SHS that they are sick, like your experience, send us this amount so that it will cater for drugs, and then you go back, there is no record, no receipt whatsoever to even cover those monies that they have collected from us. And then data issue. We had an experience in my region where one SHS student passed, in school. I mean, she fell sick and so many. And then when we went, in fact, National had to come to the situation because it involved the life of somebody, a student. And when we went investigating how the whole thing happened, this student had visited the sick bay several times, but no records. No records whatsoever. It was only the last visit. But the students who were with her in the dormitory, who even accompanied her to the clinic, mentioned that, oh, she was there on this date, we took her again on this date, and so on and so forth. So these are some of the pertinent issues when it comes to practice of school health nursing. So now we're going to have an open forum. We want your contributions. What do you think is the way forward for us? What should we take home? What can we add on to policy to make sure that school health services, attains that level that we are expecting? So the floor is open for us, please. So we have 10 minutes for this session. So we'll invite 3 questions from this end, from the right hand, and then 3 from this side. We hope we could do that in the 10 minutes. So So there could be questions or comments, suggestions for improvement. Thank you.
Yes, thank you very much, Director and our astute panelists who have delved into this topic at length. I have a contribution. And in dealing with stakeholders, I would propose that we engage the alumni, because one school did that so well in the Nzima Enclave. They put a very beautiful infirmary, and we're also supporting the school with the drugs. And then again, so this one goes to our rep from the Ghana Education Service. What would you advise in terms of a headmistress who, by being so innovative, wants all school students who come from recess screened and tested for pregnancy? What does the policy say in this direction? Thank you.
Thank you.
Thank
Hello.
you.
Can I?
Please, can I take on this side? Yes.
Thank you very much for the opportunity. I think I want to share my experience from Upper West. Are you hearing me? Yes, I want to share my experience from Upper West. We started this infirmary at Wasek and Wapole. And what we did was that, as at that time, that was in 2013, we used the same room, the mother facilities, to stand in for the schools. But along the way, by the health insurance policy, it was a criminal act. So my director asked, we apply for accreditation for the facility. And it was considered as a cheap compound, WASEC. They assessed the facility and gave her accreditation. We started operating, so we're using the health insurance, and we have our own accounts, drug and non-drug accounts. And so, by their policy, they also came and assessed the facility. You might have the needed tools and documents, so that the consulting, you might have a consulting room book where you consult, indicate all the findings. We have a drug book where those indicators were there, so you could document properly for assessment. So we did that, and was functioning very effectively. So we have to use that module for what technical, because by then I was a nurse practitioner. So they used my license to get accreditation. So we have our 4 staffs there. We have a community health nurse there to render those as services, and then 2 other enrolled nurses also came and joined. So it was a full health center. We operated very well, and we had enough money. Our accounts was great because we received from them health insurance reimbursed into our account directly, and we go into medical stores and pick our medicine. So it stood up very well and was functioning effectively. So we scaled up to Wapole, and it works well. But what happened was that, according to sources, they suddenly wrote a letter they should stop they should withdraw the accreditation for all health facilities that are facilities that are operating as schools. So they withdrew the accreditation for WASEC. And so we have to we pass through the regional director, health insurance, other policy to see what was the need. And we could justify that even the CHIPS compound, the population in certain schools were bigger than some communities that were giving accreditation for CHIPS compounds. We have to justify all that. And other directors saw the need and came in. But we don't know, we did all that we could, and they refused to renew the accreditation. So I think we need to pursue that. With that, the schools are even greater to be managed as a health center
sometimes, because we were about 6 nurses. I was the physician assistant there, and then we have other 5 nurses there. So it was more or less like a health center, and we're functioning effectively. We have the referral system. So by the policy of health insurance, you must meet the criteria. And so we met the criteria. We knew when to refer and when to those we could manage. And I was a resident nurse practitioner there, so they could call on me in the night and I attend to them, and we knew those, so it was very good. So, but I don't know what happened, and that thing got up. So we have to explain that.
I think your point has been well made.
Yes.
We'll be going into groups to discuss this in detail. So maybe we'll look at the model you are proposing again, and let's see how it helps. Okay. Thank you very much. Yes, next question.
Thank you for the opportunity.
I said 3 each, please. 3 questions from my left-hand side, 3 from my right. We have 10 minutes. We've used 4 minutes already. So next question, please.
I'm Gladys Bua, Sunchreso Government Hospital. We have 11 schools we are running school health at. And out of the 11, 4 of them have resident nurses. The issue is that most of the students that come, their insurance cards are expired. So when they have to assess the care, even though structures have been put in place, like when you come in the first time, they capture your information, and then they are giving the claims form to get the CCC code for them at the hospital when it is submitted at the end of the week. Every week they do submissions at the hospital. We generate the code for them to work with so that they can get all the drugs they were given to be working with at the infirmaries. Now, when these kids come and then their insurance card are expired, and you ask the teachers to help reactivate them, it now becomes a problem. So for us, we have a well-structured school health program, which is running just like it will be at the clinic. We have a doctor on standby who helps the nurses to care for these kids in case they need extra knowledge on whatever they are handling. We have all these nurses doing the care that they were trained to do. But the problem is with those who have expired cards. And I plead that Ghana Health Service will put in something that it must be a must-have when you are coming to school. It should be something that every child should make sure that their card is active, because that is what is a challenge for us. They ask the nurses to write the drugs for them so that the house mistress will go and buy it for the person.
The point is well made. Thank you very much. Yes.
Thank you for the opportunity. Please, mine is on about to our dear sister from the Ghana Education Service. We are pleading that you get accommodation for all the nurses in the schools, especially in the secondary schools, so that they will be there permanently for you. Secondly, in the primary schools, realize that they go on...
Please, your first point again, about accommodation.
They should get accommodation for our nurses in the schools.
It's a suggestion?
Yes.
Okay.
So that they will be there with them. That one, you can call there in the night, in the afternoon, in the evening, should be around your compound for you. Thank you. Secondly, about their leave. Because we are running the track system, if you have only one nurse in the school, how does this nurse take her leave? But then when she's supposed to rest, another track comes to school. So it's becoming a challenge for some of our nurses. And then those in preschools too, they have 2 vacations or 3 vacations. So every vacation, the nurse is on leave. We have to look at these gaps, because the nurse is supposed to take 36 working days as a leave in a year. So if one semester, one session, the school is on leave, so the nurse is on leave. And then another time, the nurse goes on a leave again. Meanwhile, her colleague nurses at the ward working. So we should look at these 2. One person is suffering, the other person is enjoying.
Okay, thank you very much. When we get into the group, some of these issues will be addressed, please. Last person from this end.
Yes, thank you very much. Please, mine is on the staffing. In my district, we have 3 secondary schools. And the whole district, we have 3 RGNs for the districts, health directorates. So we were forced to send these RGNs to the schools. And we did that. But we saw that it is not enough. We need to back up because of the leave system and others. So we should just maintain the RGNs only. Because as we are talking now, there are 3 RGNs that we have. 2 has declared their intention for school. So now we will get only 1 RGN to mind the schools. So I don't know. So should we still maintain the CHI or the program will give us some RGNs? Thank you.
Thank you. Thank you very much. Last question from this end.
Thank you. Mine is not a question, it's a contribution to improving the school health nursing services. I recommend that when the policy is reviewed, the review is over. Ghana Education Service, we are pleading that if the teachers also will be oriented on what the policy entails, because most times you go to the school going to implement something that have been agreed on by both Ghana Education Service and Ghana Health Service, then you'll be asked, where is your permission letter? Meanwhile, it is coming from both outfits. So I would recommend that the teachers in the schools also are oriented on the components of the school nursing services so that it won't create problems. And then to Ghana Health Service, the nurse managers in the facilities, mother facilities, also need to be oriented, because when the nurses are assigned to the schools, they are left orphaned. Even end of year, whatever that they share, they don't give them. So they are left orphaned. Oh, please, I'm talking from experience.
Yes.
So they don't give them. They are left orphaned. Nobody visits them and all that. So that will help to improve.
Thank you very much. Okay, so panelists, I think most of them were suggestions, but for the first question about pregnancy tests for students upon admission, what are your thoughts, please?
Unfortunately, it happened to one of your doctors. The girl fell sick, went to the sick bay, and was told that there's no pregnancy kit, so she should wait. She waited for 3 good days before they got the pregnancy kit. She paid for the kit, and then she was tested, and then she was referred to go to the mother facility. Unfortunately, she got to the mother facility late, where she was weak, alone, lying somewhere. And a mother saw her, gave her phone to her to call the mother. And you can just imagine, a doctor at Kolebu, your daughter somewhere in Bono, and now you have to travel. So the doctor called me, and I had to liaise with the regional director to let somebody go and attend to the girl at the clinic. Per our policy, pregnancy testing is not part of it. And we are not supposed to discriminate against any child. So whether the child is pregnant or not, that child is supposed to benefit from education. So if that is what our policy is saying, then why will you test the girl before you give the child the needed service? And we have noticed that that is happening.
Hello, easy.
Hello.
Easy. All right, I think.
Hello. Yeah, so maybe you didn't get me right. Before the child was attended to by the nurse, the child had to go through pregnancy testing.
The reason why they are reacting is that the suggestion came from the school. I think it was the school that was asking that they should do the testing before they are enrolled.
So there's something that we need to find out. Because this girl indicated that the money was paid to the nurse. She paid for the kids. To the
So
nurse.
I think
So I think it's two things that
there are two
happening.
things.
So we need to
There are
find
two
out
things, yes.
whether it is the school's policy, and if it's the school's policy,
Yeah.
who has endorsed that policy?
They just want to know whether it is the right thing to do.
It is not.
Should we test the girls before enrolling them?
It is not. They
Thank
are
you.
not supposed to go through pregnancy tests before
Okay.
they are admitted.
Okay,
Then
so
there was something on the
about NHIS activation, expired cards. Hello? Oh, please.
on the expired
We'll get
cards at PTA meetings. Parents are given education on the renewal. Sometimes you may not even know that the card has expired and the child moves to school. So they are reminded to renew the cards for the children. And most of the schools too, what they do is that they invite NHIS to their schools, let the parents pay for the registration, and then they register the children. That is for those who do not have at all. But if the school health committee is working, then the school health committee should be able to communicate to the PTA that the children are having the expired card and they need to renew them. Thank you.
So I think that there should be that deliberate effort to, regularly check whether students' cards have expired, because somebody will be in the school for a whole term and will not fall sick, so will not need the card. And I think that's what happens. And then suddenly the person is taken ill and the card had expired. So Star Gifty, please, your final comments. But before that, there was an issue about teachers not being oriented about programs that Ghana Health Service organizes in the school, like screening programs and things, and so getting their cooperation. And I know that especially the private schools, we have issues with them a lot. And I was saying that commending the last program, HPV vaccination, that it looks like the collaboration was stronger this time, and so most of these issues were minimal. So what can Ghana Health Service, from our point of view?
Let me respond to that before she comes in. Private schools are no more under GES. They are now under NASIA. And private schools have 3 good associations. So if you don't involve all the 3 of them, you have challenges. So the HPV, the women exercise, what we do is that at the stakeholders meeting, we invite all these 3 associations. They have the NACOP, but the NACOP, some of them are not private schools association, yes, of Ghana. Some of them are not the owners of the schools. And usually the problems are with the owners of the schools. They are business-oriented people, and so anything that they think will affect their business, they will not allow. So if you get their leaders to buy in, then you have your way through. Then on the communication with the teachers, I think we all have communication gaps. And we ourselves know, so we are working on that.
Thank you very much.
Yes, so, Madam has responded to the communication, so I wouldn't touch on that, but I'll touch on whether CHNs are supposed to be withdrawn from the schools. That's a human resource issue. Before a school clinic is certified to be functional, there needs to be the right cadre there to provide services, and we do identify that there are gaps in our human resource capacity. But can we as a fraternity be a bit innovative about trying to engage those who are sitting at home? No, we have professional nurses who don't have financial clearance, so because of that they have no. So I'm thinking that maybe we need to start thinking outside the box together with GES. If GES would help us to engage some of them, but under some arrangement. Please, when you also react, I also get confused like my director.
So please, when we get into the group, some of these issues will come up. I think we've been here for quite some time, and so we are just trying to round it up. And then when we go into the groups, let's bring some of these issues up for discussion. So your last words.
I think there was one question GES was supposed to address. It has not been addressed. Somebody asked that as we are 2 bodies in this business, should, for example, we have a program and the letters will come from the heads, Ghana Health Service, GAs. But you go to the school and the school is saying that, what permission do you have to come? I remember once there was a program, we went to Wesley Girls, and we were supposed to talk to each parent. The child will tell you, I have to talk to my mommy, I have to talk to my mommy. They call mommy, and mommy will say, I have to talk to the nurse. So, I don't know, can GES come in here to help us?
Yes, thank you very much. I think it's similar to what we discussed earlier about teachers not being involved before programs are rolled out in the schools. Okay,
so a program. So letters will come from two institutions, Ghana Health Service and Ghana Education Service. We'll discuss it at the top.
Okay.
But when it gets to the, implementation units, it's like we have to engage. You engage, and some of the schools give us problems. Okay. Yes. So that's why I wanted to address.
Yeah, so I will simply say work with the school health coordinator at the district. If you work with the school health coordinator at the district, you won't have any problem. Yeah.
All right. Thank you very much. Please, CNO, do you have any final comments? And then Kosia will also give us a final comment. Then we close from here.
Thank you so much. I think from the discussion so far, we've realized that school health services is very crucial if you want to have good leaders to lead our homes, to lead our institutions, and also to lead the country. So I will indulge all of us to join our hands together to empower our school nurses, to empower our students. And I think we have to ensure that we have a healthy future leaders that will come and then will take up our position. We all have a role to play. So I think this is what I have for now. Thank you.
Thank you very much. Thank you. So, Akosia, your final words.
Please, I think we would have to have more stakeholder engagement. And like we said, whenever the decisions are taken at the top, it should rally down to everybody so that implementation becomes easier.
So we'll give it to Sagit. Your final words.
That we look at the guidelines critically and then come up with innovative ways of implementing them when we get into our groups.
Okay. So please pass it on to.
Okay. Thank you. So as she indicated, school health services are very important to us, and as researchers have made us known, without achieving SDG 3 and 4, it will be very difficult for us to achieve the rest. So let us work together in order to help Mother Ghana. Thank you.
Thank you. Please end it all for us, our host, Regent.
I think that the education is good for health, and health is good for education. So we need to strengthen our school health so that we'll have healthy people working for the development of our country. Thank you.
Thank you. Thank you very much. Let's give them a round of applause. Organizers, please forgive us. We've gone beyond the time given allocated to us. We are sorry about that. But I think it's a very interesting discussion, isn't it? We've had very interesting discussion. And it's very important that we all take school health services very seriously over here. They are a large majority or population that we need to focus on. And we know that most of them are within the adolescent age where they are curious about a whole lot of things. And the school environment, if it's not well taken care of, will rather expose them to antisocial vices, and we do not want that. So as we go into the groups, please let's put our heads together to make sure that we come up with strong points that we can carry on to make sure that the policies and guidelines that are coming out for school health will help our children and the nation as a whole. Thank you very much for your attention.
Thank you very much for this discussion. We'll be moving into group work, but before that, Professor Lydia Ziato, Prof. 1, is around to give us some interesting message. With a round of applause, let's invite her.
Good afternoon. I missed my airway dance. It's rather unfortunate. Next time. So I'm taking just about 5-8 minutes. I am here because if we do not draw attention to some critical issues that as nurse and midwifery leaders, we should pay attention to, it will be difficult for us to break some of the spaces that we are not found. I am anticipating that in the future, a nurse can be my member of parliament or my minister. I'm anticipating. Now, before we can get this done, we need to start helping each other to earn extra money. Politics these days, if your pocket is not deep, you are out. All of us, we belong to one party or the other. Before I, the minister, will give you a board chair or a board member, you should have contributed significantly to the party. I've read a lot of social media posts on how we are not seen in most of the boards. The hospital level, national health insurance, this and that and that and that. Once the thing is health, even traditional medicine, you are supposed to be there. Vaccine Institute, you are supposed to be there. Yesterday, I didn't say a lot because you see, you don't say all at a time. But what the UNFPA country rep mentioned is something that is not to be taken on face value. If we talk and we don't do anything, it won't happen. It will not happen. So I'm saying that as nursing and midwifery leaders, if me, I am tired, my young one should learn an extra skill to get extra money. Even if the person is not interested in politics, it's important that we are liquid. The second is that in my journey as a nurse researcher, I've come across, so I have done some work within the nurse and midwifery fraternity over time. In one of my studies, I wept. I wept because this is a senior nurse who worked very, very hard. Her small money, she bought some land. She started a foundation to a level, land guard issue. By the time she realized they broke everything. And where to sleep? She was working at Kolebu. They sacked her from the apartment and quarters. It was difficult. One hospital matron, that those days, that's how they call them, also retired and had to stay in somebody's uncompleted facility. No electricity, borehole water. Meanwhile, you were in that bungalow with everything. Now, we need to prepare for our retirement. I know that most of us here are okay, but there are still some here who have not really thought about retiring. 60 years is not far away. If it's not on your agenda, put it on your agenda. And start the young ones early. By the time they finish the rotation and they come in, your mentorship and orientation should include their exit preparation. They should invest so they can get some money because the pension salary is not enough. And that is when you also have the diseases and all those things. So healthcare would also become an issue. The other one is documentation and evidence decision making. Over the period, it has also become clear that still our nurses are not documenting well. That is why GRMA, I think he's gone. The lawyer was saying that they lack data for evidence. When I was in the UK, Cardiff, I just worked for a year and some few months. The nurses would write, those days I was working as a carer, I was not working as a professional nurse. But the professional nurses would write and write, and I said, hey, what are you people writing? They write, hey. We need to provide the evidence of what we have done or what we are doing. It is important too that we learn and mentor our people to show the evidence of our work. The other one is investing in the next generation. Give yourself 10 years, most of us here, or 8, those of you who are like myself, or 6, we are out of the scene. Who will take over from you? Would a person be able to do it better than you did? So the nursing and midwifery fraternity, you realize that the car will be driving at hand speed. When hands change, either it stops or it goes reverse. A few times you see it moving. We need to do something about the next generation who will take over from us. The care standards, the human skills, and everything else that makes you a good leader. Please, this is important for me. Yesterday, I mentioned that we should have nurse-led interventions. Where is the budget? I do a lot of things behind the scenes. I haven't seen a nursing-specific budget in any of the hospitals that I've engaged. You see the sub-BMCs and whatever. But I have not seen a budget line dedicated to the nursing and midwifery directorate. I haven't seen it. If your hospital, you have it, can you give me a wave? You have a budget that you, which hospital is this? Ghana Ports and Harbors. Let's give them a hand. All right. I'm saying that nurses and midwives, if we don't talk about some of these things, we'll always be behind. I want us to grow, to be with the times and seasons. We need to advocate for nursing and midwifery budgets. Now, because we do not own the patient, can we have one meeting, please? Because the patient is in that sub-BMC, the budget is for the sub-BMC. But the nursing and midwifery directorate, if you are able to advocate for your budget, we can use some of these things to support the nurse or the midwifery or the midwife-led interventions that we want to roll out in our various communities, our hospital, or whatever else we want to. That the nurse is the one responsible. You can refer, okay, but the activity that you are budgeting for It's nurse-led, it's midwife-led. Don't go and fight for sub-EMC, sub-budget for nursing. The patient is cared for holistically. But when we have distinct activities that are nurse or midwife-led, we can have our budget line. And I'm saying that when you go back, talk to whoever or the team or whatever, I don't want to go there. Get their buy-in, but you don't do the buy-in orally. You write a proposal. Okay, you write a proposal to say, we want to do A, B, C, or A for the nursing directorate. And for the year 2026, we need a budget B, and force yourself into the budget line, not under anybody. I spoke to a few of you. Your nursing and midwifery directorate budget is part of the, somebody says CEO's budget. I shouldn't be like that, oh. You are the constituent with the highest number of professionals in the hospital. Try and get a budget line for nursing and midwifery. And once you get a budget line, you have to learn how to do budgets. Some of you don't know how to do budgets. You have to learn how to use the Excel. You put in formula. The figure will be adding. If you take something, it will change for you automatically. Learn how to do activity-based budgets so that when you get the money, you can use it for the purpose, and once your documentation has improved, you can account for the money appropriately. Learn how to support your report with evidence, with some pictures, with some data here, there, to show that the money that was given to you, you use it for the purpose, and this is the impact. It means that you also need to learn how to do pre and post assessment. So before the intervention, this is the situation. After the intervention, this is the situation. You factor all that in the budget. Some of you should start from somewhere. The other thing I have here is that, you see, the doctors, I'm saying the doctors because that is the reference point. When they finish their clinical work and they are working with the medical schools, they don't retire. They are in so if you are a senior lecturer in the university, you can go up to 65 on post-retirement contracts. If you are professorial rank, you can go up to 670. Okay? Now, when you are doing what I am saying and you publish it, by the time you finish your work, you can get some papers. Even if you are not doing it alone, you are doing it with your mentees, those who have done their masters, put them along. If you want to join any institution, whether a private or whatever, you can enter as senior lecturer or even at the professorial rank. Because the 60 years, you realize that they are still strong. What are you going to do in the house? And then when you get some private something, they cheat you because they think that, oh, they are just using you for a while. So I'm saying that when you do your intervention, your nurse-led interventions, publish the data, okay? So that you can use that for future opportunities. The last thing I want to draw attention to as you discuss among you, I'm doing this because I may leave very early tomorrow. I'm multitasking, so that's why I'm here. The last thing I want to talk about is that the nurse or the midwife, now there are a lot of funding opportunities that you, if I say you, it's you and me. You can apply for funding. UNFPA was here yesterday. UNICEF, we are talking about school health. Who said that you should not look for money and do your own activities so that even if your hospital refuses to give you a budget line or support your initiative, you can apply somewhere. So I'm saying that rather than look for money from the hospital that they may not give you, try and see how you can seek funding from other sources to support your initiatives. If we are able to do this small, because you are many, Ghana Health Service will control everything. if every region, we have 2 or 3 nurse-led activities, 1 or 2 here, there, before we realize our fraternity, the impact that will make on our people become more than any of us can anticipate. So these are some of the few thoughts I want to share with you all as nurse leaders, midwife leaders within the Ghana Health Service. Let's try and see how we can make a change. If you don't have money, you can't contribute to the campaign. When I win, I won't give you the position because you didn't contribute much. On this note, I rest my case. Thank you.
Thank you so much, Professor Chair. We'll be breaking into our respective groups. If you have registered and you have the tag, you see there are some numbers below it. We have J1, J2, J3. The J stands for the groups. So, and the labeling has been done. So kindly check where the group number is, and then you get into that group. So the grouping starts, group 1 is here, and then it follows as such. Those who don't have the tags, please kindly walk out, and then the IT personnel are there. You just tell them the region you belong to, and then they will get it for you, please. Some of the groups are outside.